And Japan is facing mounting criticism for its handling of the virus-hit cruise ship, even as quarantine on the vessel comes to an end. Experts have questioned the authorities' decision to keep the passengers on board. There are also concerns regarding the effectiveness of the measures taken to manage the outbreak. Now for a closer look, we're joined by Professor Eyal Leshm, the Director for the Center for Travel Medicine and Tropical Diseases at Sheba Medical Center. Firstly, passengers are now allowed to disembark after a 2-week quarantine period. In your view, though, was the 2-week wait served well or quarantine justified?
Oh, absolutely. The government, the National Institute of Infectious Disease, has just released a report describing the outbreak management and the investigation. So the travelers that are allowed to leave are travelers that did not have contact with any confirmed cases, have spent the 14 days isolated in their cabin, and have been asymptomatic. So I think it is more than reasonable to allow these passengers to leave, with a caveat that if they do end up developing symptoms, they need to be monitored and tested. Others that have had more recent contact with patients, they need to stay quarantined and examined in case they develop symptoms.
Professor Eyal, Japan has been criticized for the handling of the Diamond Princess, and many are saying that allowing the passengers to stay on board was actually an incubator for the virus here. From hindsight, what alternatives could Japan actually have adopted, though?
Well, first of all, on this report released by the Japanese government, they report that most patients really acquired the infection before the quarantine was implemented on February 5th. Many of the other cases were diagnosed either in roommates of patients that were diagnosed or in staff that have been in contact. The only other alternative would have been to disembark nearly 4,000 people from the ship and then put all of them in separate quarters, which would have been not necessarily a better option and could have been very problematic both logistically and psychologically for people to spend in isolation 2 weeks when they are completely asymptomatic.
By comparison, WHO says that cruises can, in fact, carry on with the appropriate measures in place. What do they mean by appropriate measures, though, and do you agree with that?
Public health is always a balance between personal freedom and freedom of movement and on the other hand, protecting the public from hazards like an outbreak. And I think WHO situation assessment is currently that cruise ships do not serve as a major risk for the public. Appropriate measures would be fever screening, implementing isolation and quarantine to people who are potentially infected, and the capacity to disembark and test people that are potentially infected if those do come up being diagnosed.
All right, many thanks for sharing your thoughts with us this evening. Professor Eyal Leshm, Director for the Center of Travel Medicine and Tropical Diseases of Sheba Medical Center.